Well, good afternoon, good morning to some of you all. Thank you all for being with us today. It's such a pleasure to be with you. I'm so excited about this really important conversation that we're going to have today. We're having our next installment of our Healthy Moms, Strong Babies series. And I'm, again, so excited about our topic today, which I think is so timely and really so important for so many families. October is a pregnancy and infant loss awareness month. And we obviously can't think of a more appropriate issue to be talking about in our Healthy Moms, Strong Babies series than this issue of the loss of a loved one, the loss of a baby, the loss of even a mom as a result of pregnancy and childbirth. So today we're going to have a really, really important conversation with some amazing people who are suffering through, some of them fairly recently, for others maybe some time ago, probably one of the most painful things that anyone can imagine experiencing, either the loss of a newborn baby, a loss of a spouse. Uh, it's something that is so incredibly hard to imagine going through, but it's something that is so incredibly real for far too many families in this country. Unfortunately, about 10 to 15% of known pregnancies end in miscarriage. Stillbirth or loss of the baby after 20 weeks of pregnancy affects about one out of every 160 births. And more than 21,000 infants are born in the US but die before their first birthday. So these are a lot of very, very painful stories, each and every one of them. Uh, a painful story that could be told. Um, for many families, it's really hard to tell these stories. Just having to relive the pain is often too much for so many families. And we don't want to do anything that would sort of re traumatize any family to retell their story over and over again. But I'm really honored that we have some very, very brave and courageous individuals with us today who are able and willing to share their stories, in part because they are committed to sharing their stories in a way that provides hope and strength to other families. Hopefully, it'll be healing for them as well. We have talked a lot about the March of Dimes about these issues of pregnancy and childbirth related complications around maternal death and infant mortality. But sometimes it's not real until it actually happens to your family or it happens to someone that you're very close to. I think a lot of people, while we may not be personal friends with Chrissy Teigen and John Legend, were absolutely moved by what Chrissy and John shared on Instagram and shared on their social media. Those pictures of Chrissy, especially and Chrissy and John together with their newborn baby, Jack, who did not survive, were just heartbreaking. And it was heartbreaking not only to imagine being in their shoes, it was even more heartbreaking to understand what it took for them to even share that publicly and to have the courage to do that. And we're grateful to them because what it did was, and in fact, we saw this at the March Dimes, so many families who connected with them, who understood that pain, and who received some degree of hope that they weren't alone. And that's really what's really important right now, is that we never want any family to feel that they're alone because of any kind of tragedy that they've had to experience with the loss of a baby or a spouse. It's also why you'll see on my virtual background that we are demanding blanket change at the March of Dimes, and we're proud that we have been joined by some of those that are represented today in our panelists, but also over 70 organizations we're standing with to demand blanket change, demand that if you're going to the polls to vote for someone in November, a member of Congress, president, uh, a state or a local elected official, whether they're Republican or Democrat, it doesn't matter. We're asking you to get involved in making sure that every elected official, if they have anything to do with ensuring that we have the best health care provided to every single individual in this country, that we eliminate this issue of our maternal and infant health crisis, that we actually demand that those that represent us do something about it. And that's what blanket change is all about. And I'll come back at the end and talk about it. Hashtag blanket change, share it on your social media, go to blanketchange.org, get more information, sign up, learn how to tweet your elected official, and certainly learn more about what policies we're recommending need to be enacted to make sure that we can eliminate, if possible, any preventable maternal death or infant death. Also, we're Facebook Live as usual, so please, please, please feel free to put in your comments, share your story, ask a question. Please just get engaged with us right now. We are live, so we can take your questions live. And if you use the comments on Facebook Live, we'll be sure and take your questions as we go. Without any other delay, I want to just now introduce our amazing panelists. Again, my name is Stacy Stewart. I didn't introduce myself, I don't think, at the beginning, just jumped right into it. I'm president and CEO of the March of Dimes. But I'm really, really honored and pleased to be joined by an amazing group of panelists. I'll start with introducing Dr. Amy Crockett, who is with us right now, I think. Here she is, there she is. We're worried about Amy because, Dr. Crockett, I should say, because she's a physician. She's a director of the maternal and fetal medicine program at Prisma Health Upstate and the University of South Carolina School of Medicine. She's in the process of monitoring delivery of triplets as we speak. So if we see her drop off for any reason, you know that she's just doing her job, making sure that new babies come into the world safely. So we appreciate that always. She's been a great friend of the March of Dimes. She provides care for pregnancies, especially to high-risk mothers. She is the chair for South Carolina section of the American College of Obstetricians and Gynecologists. That means she's a big-time OBGYN in South Carolina, in other words. And she has been the clinical lead of the South Carolina Birth Outcomes Initiative since 2011. So Dr. Crockett, thanks for being here. We have a substitute teacher if Dr. Crockett does have to drop off. And if she does, I'll introduce who that is. Next panelist is Erin Truxillo, is the executive director of Pockets of Light. Pockets of Light is an organization that offers peer support for families that are grieving, offers support to them if they've experienced the loss of during pregnancy or loss of an infant. After experiencing their own loss, Erin and her co-founders were determined to help others, which I always think is the best way to heal, is to help others to address their own pain. They became trained to facilitate support groups through Pockets of Light, and they've helped over 300 families in their community in just the past 4 years. So Erin, thanks for joining us. And then we also have Xavier DeLeon and Tracy Dominguez. Xavier and Tracy are the founders of Justice for Demi and Baby Malachi. You're going to hear their story in just a little bit. But in 2019, Xavier lost his fiancee, Demi, who's Tracy's daughter, and their baby Malachi due to undetected preeclampsia that Tracy was experiencing. That Demi was experiencing. Tracy lost Demi and Malachi. Xavier lost his fiance and his baby. Together, they began their organization to honor the memory of their loved ones and advocate for improved care and accountability, and end racial bias in maternity care, which is so important. And that's an issue and a topic that we have discussed a lot, and we will talk about it some more today. We do have a backup panelist, Jennifer Settlemeyer Johansson, who's with the March of Dimes in case Dr. Crockett has to drop off, and I will introduce her if she does. So I'm just going to moderate our conversation and really just start the conversation with Dr. Crockett. And thank you for joining, and thank you for being such a great friend and a great healthcare provider in South Carolina, a great friend of the March Dimes. You know, Dr. Crockett, we talked about pregnancy loss happening 10 to 15% of the time, but talk to us about why does this happen at all? Even if you could just talk about, we talked about miscarriage, stillbirth, give us a sense of what are these things and why do they happen?
Thank you again for the invitation to be here, Stacy. I'm a huge fan of the March of Dimes and very grateful for all the help that you give us. So it's a pleasure that I can be here today. And you're right that about 10 to 15% of pregnancies don't make it to term. It's very different when you compare first trimester to second and third trimester pregnancy loss. In the beginning of pregnancy, it's very common to have chromosome or genetic problems that are with the pregnancy that cause miscarriages, sometimes even before women know they're pregnant. When you get past the point where you can see a heartbeat, the risk goes down for pregnancy loss. And then once you get into the second and third trimester, it's really less than 1% of the time. It really becomes much, much less common. And even though it's less common, the causes are much more complex as you move into pregnancy and later into pregnancy. And you'll hear from the stories of the panelists today that really it's a number of different things that can contribute to this. Most frustrating for me as someone who has cared for a lot of women with pregnancy losses is that sometimes you actually never even know. About a third of the time, we don't even find an answer. But if somebody who's listening to this today has had a pregnancy loss, I think there's also a message of hope in this too, and that there are a number of causes of pregnancy loss that we can anticipate and look to avoid or might not recur in a subsequent pregnancy. So I spend quite a bit of my time making plans for people that have had outcomes they weren't expecting or hoping for in a pregnancy, and trying to have a happier ending in the next time. So there's definitely hope out there, but it can be quite complex, and it's worth talking to your own doctor about things that happen to you specifically.
Sure. But in your experience, when you've had a family, especially a woman who's experienced loss, how do you counsel her the next time if she chooses to get pregnant again? How do you counsel her, or what are some of the things that you think about with respect to a subsequent pregnancy, or how do you talk to your patients about that?
Well, sometimes it's maternal medical conditions that contribute to the poor pregnancy outcomes. And so being as healthy as possible and planning your pregnancies is always a really good, way to begin at the beginning of pregnancy. And then, sometimes there are causes that, would have a lower risk of recurrence in a subsequent pregnancy. If there's a knot in the umbilical cord, for example, that really is just something that's bad luck and difficult to anticipate, and fortunately doesn't happen very often. Or if there was a genetic problem in the baby, we can talk about whether that's has a recurrence risk because it's something that's, one of the parents, a gene they carry, or if it was just a random mutation that might have a low risk of coming back. So depending on the cause of the pregnancy loss really drives the risk for recurrence. And that's why it's worth having something, very personal recommendation about what's happened and what the chances are for it happening again.
Great, thank you. And we'll come back to you for more. I want to now turn it to Erin, though. Erin is, as I mentioned earlier, is the founder of Pockets of Light, which provides support to other families who've experienced loss, and she and her co-founders have been providing support to a lot of hundreds of different families over the last few years. Erin, tell us about your story of loss, and then what inspired you to really start Pockets of Light.
Yeah. So my story began in 2008. My husband and I were expecting our first child. We found out we were having a girl, and we were over the moon, very excited. It was a really easy pregnancy, really no cause for concern. And then when I was 35 weeks pregnant, my water broke. And when that happened, I started to lose blood. With it being my first pregnancy, obviously I knew that it was a cause for concern, but certainly not to the extent that, I didn't realize quite how bad this was. We did rush to the doctor's office. They did find a faint heartbeat at that time. And then I was transferred to the hospital in labor and delivery. We had 3 nurses try to find her heartbeat. They couldn't. I was rushed into an emergency C-section. And when I woke up, they told me that my daughter had died just prior to delivery. We came to find out the cause was a rare pregnancy complication called vasa previa. We, like every family that's gone through this, we're just in complete shock. We didn't think this happened anymore. We thought stillbirth was a term of the past. And we're just devastated. Leaving the hospital without my daughter was the second worst day of my life. And we kind of got through things day by day. I feel very fortunate for the care that we received in the hospital. Our nurses and doctors were wonderful. they had such compassion for us and really helped us during what was an extremely difficult time. Shortly after we left the hospital, we were referred to an organization in Charlotte, North Carolina, where we lived at the time, called Kindermorn. And we received some amazing support there, and met other couples that were going through what we were going through. And when we moved to New Jersey, I was connected with my two co-founders. We had all experienced different types of loss, ranging from recurrent miscarriage up through early infant loss. And the three of us decided that we wanted to create a space for families to go who had been through a pregnancy or infant loss. We wanted to make sure that people knew, there was help out there. There were people that had gotten through it and that they could too.
And so how do you work? And I guess you're working a little bit of a virtual way, which is, I assume, now through with COVID. But how do you conduct the kind of support that you're providing to families today?
Sure. Yeah. So we offer a couple different support groups. Typically, they're in person. Right now, they are virtual. We have a miscarriage support group, which meets monthly. We have a stillbirth and early infant loss group that meets for 7 consecutive weeks. And we have a pregnancy after loss group for those that have lost previously and are now pregnant again. And we really try to make sure that we're serving the needs of the moms and dads. And so we have a male and female facilitator at our groups. And we just try to make sure that everyone's needs are met, everyone's heard, and that we're, providing an environment where people are comfortable talking about their babies and remembering their babies.
That's great. Well, I know that means a lot to so many. Erin, thank you for doing what you're doing. And we'll come back to you as well.
Okay.
I want to now turn to Xavier and Tracy. And as I mentioned earlier, Xavier, you lost your fiance and your son, Malachi, your fiance, Demi. Tracy, you lost your daughter and your grandson. Talk about that story and how you've been coping with the loss of both a mom, a fiance, a daughter, and also a son and a grandson. And I don't know who'd like to go first, Tracy or Xavier, whichever one of you would like to go first, it's fine.
I'll go ahead and let Tracy start it off, and then I can piggyback off of what she's saying.
Perfect.
Okay. Demi was 23. She was about to graduate, and she was a week before her, her baby shower. She just didn't feel good. She had some swelling, and she just didn't feel good. So she took her blood pressure here at my house, and it was high. So we ended up taking her to labor and delivery because she couldn't get in to see her doctor that day. She called. At labor and delivery, she walked upstairs, elevator, of course, and we went to the nurse's station, and she explained her symptoms to the nurse. And there was a doctor, I assume he was the doctor behind her, and he asked her what she had eaten that morning. And she said, I had Mexican food. And he goes, well, that's why you're swollen. And she kind of was embarrassed, and patient blamed her, And then we went to another room, and she told the nurse her symptoms, and they put her on the monitor. And her blood pressure was high. And the nurse said, I'm going to give you some medication. And it increased instead of decreased. And then they took all the blood work, and they decided to keep her. They told me 23 hours. We stayed with her up until 10 o'clock, I think I left. And no doctor had seen her. No doctor came in to evaluate her, nothing. They just put her in her second room. And we didn't really know anything that was that, other than her blood pressure was high. Nobody was saying anything to us about any diagnose or any plan. And then I called Xavier, and then he came to stay overnight with her. And then you can continue, Xavier.
So, I had got the call. I was at work, and about time I got there, they were in that first room that they were holding her in. So transferred to the second room. got her taken care of, set her in, hooked her up to the machines and all that good stuff. Um, at this point, I didn't know who the doctor was. I didn't see any doctor. Nobody introduced themselves to me at all. So, not really knowing, you're kind of just going with the flow. I mean, I was at that point. So stayed overnight, got released in the morning, went to go fill out her prescription and get her what she needed. And then I honestly can't remember the exact day, but I know it was a couple days, like a day or two after, just like a regular day, had dinner together, watching TV, just another night before work. And so we get ready to go to bed and we go to lay down, gave her a good night kiss, kiss goodnight, said I loved her, gave the baby a kiss, on the stomach, and fell asleep. And in the middle of the night, I don't know if you guys ever had that feeling where it just felt like something was wrong. So I woke up in the middle of the night and, I had that feeling, and I seen her kind of moving the blankets around, and I was kind of like, oh, maybe she's just tossing and turning, but something was like, something's not right. So I get up to look, and that's when I seen it. I'm sorry for everybody, but it's the only way I remember it. I just seen her jaw was locked and she just was shaking. So I automatically thought seizure. So, I'm trying to wake her up and at that point I called, 911, and they instruct me on what to do. So I had to give her chest compressions until, the paramedics arrived. But I believe in my heart that, she took one breath and I thought she was coming out of it. So I got happy automatically, and then she kind of went back into the whole shaking and things like that. And she started turning blue. And at that point I was like, man, this is not looking good at all, So, I'm there trying to help her. And I remember her taking like one big last breath. And at that point I was just like, man, I already knew what happened kind of thing, but I didn't want to believe it. So we, paramedics get there, they take her to the hospital. And at that point, it's just like a movie, like everybody's crying, it's like the movie Selena, like when they're at the hospital, like all that commotion going on and everything like that. Like that's the way I describe it to people. And, they performed emergency C-section on Malachi, which felt like forever. It's just seeing everybody go in and out of the room, trying to help, a bunch of people calling for stuff, it was just hectic. I could still hear like the screams and everything in my head. So about time, the doctors came to me, they said, who's the dad? And I was like, well, that's me. And then he kind of looked at me and put his hand on his shoulder and he was like, I'm sorry, but your wife has passed. And you just feel the air get taken out of everybody in the room, and he goes, but your son has lived. And so I walk over there to where they were doing everything, and I sat down with Demi one more time and told her I loved her and everything like that, gave her a kiss. And that's when I first seen my son, Malachi, and that's when we took him up to ICU and they were doing what they had to do to save him. But they didn't have I guess it wasn't the right resources they needed at that hospital. So he actually got flown via helicopter to Valley Children's out in Merced, where I followed. But, got a phone call from the doctor pretty much saying that it wasn't looking too good while I was on my way up there. But by the grace of God, I got there, and he pretty much told me like, your son's, there's nothing else we can do for your son. Like there was no brain activity. So at that point, I was lucky enough to have some pastors come and pray over my son and got him baptized and prayed over him so much. It was crazy. My family got to hold him and see him, while he was in the machine and all that good stuff. I actually got to change his diaper, which was pretty cool. And it was really neat. Kind of just showed how, looking back at it, connecting the dots, it kind of just, God has a sense of humor still, and I know that sounds super weird, but when I was changing his diaper, Malachi peed on me. And I thought that was the coolest thing ever, because like, at that point, it was like he was saying goodbye to me, so after, I changed his diaper and all that good stuff, I made a decision to pull him off life support, and held him in my arms and walked him down this hallway into this, I think it was called the butterfly room. And, I opened the door and you just see a big wooden rocking chair that you see in the old movies. And I was just like, man, so I sat down and held Malachi until he took his last breath. So he died in my arms as well. And the way I describe it, the way kind of Malachi went was, it was just like if he was having little hiccups. he had hiccups, and it was just like, oh, and so I just held my son and rocked him until he took his last breaths. And before you know it, sometimes I got caught up, just trying to have a conversation, and then I realized like he wasn't breathing anymore. So then at that point, that's when I realized like it's gone. He's gone. So yeah, that day, I'll never forget that day. It was the worst day of my life for sure. And yeah.
Yeah.
Yes.
This has really like been really hard on my family, her brothers and her sisters. They struggle every day because if you knew Debbie, she was like always wanting the best and always tried her hardest and never got in trouble and did what she needed to do. And she had a plan. She always had a plan. And for her to pass away without a chance with medical negligence, we didn't say that she also went to the doctor on Wednesday and he missed her symptoms and rushed her out and bed rest and you'll be fine. No, and that's when she passed away. But I know that she wants, her story to be told to save mothers and other children and other families and young girls, because I tell everybody my story if at this grocery store or wherever, and none of them know about preeclampsia. They're very, very unaware of the symptoms. So that's our goal, to help with that. But, I walked the stage for her. She graduated, which was extremely hard because she worked so hard to graduate. She was a behavioral therapist for autistic kids. I have some autistic grandchildren, and she's always been the best aunt and loved them since they were little. In high school, she worked for autistic children, so she already knew what she was going to do when she got older, and that's what she went for. No doubt in my mind that she would have finished and got her master's and continued in the community to help children one at a time. So
Yeah, without a doubt.
I guess, that's where we carry it on now, to save one baby and one mother at a time. But,
Tracy, thank you, and Xavier, for sharing that. I want to ask you, and it's very hard for me, so I apologize. I'm getting kind of emotional myself, so I'll try to keep it together for you guys. But that was so powerful to share all that. How are you? I mean, obviously the pain is still very raw and still very fresh on your hearts and your minds every day. But talk about what you're doing now. How are you? Because Tracy, I hear you talk about, your commitment to make sure that this doesn't happen to any other family. How are you turning this pain into sort of action at this point and trying to call for justice for Demi and Malachi? And Xavier, do you want to start?
Yeah. The main thing that helps me is I got real close to God. It was almost like it was a wake-up call, I went to private school a lot of my life, so I kind of knew of him, but this kind of really made that relationship strong. But it's just just like turning a negative into a positive. I don't want to be, you can knock me down, but I'm not going to stay on the ground kind of mentality, and just because of the hurt and the pain that I feel and Tracy feels and my family feels on a daily, I don't want any other family to go through this. So that's what motivates me, at least in my family, to keep on pressing to try to spread the story, even though it hurts to tell the story every time. That at the same time, I know maybe some way, somehow it helps somebody to be aware of it or be that a little bit more open to a second opinion or whatever it may be, because I mean, this happens every day. You just don't hear about it until it happens to you, kind of thing, So really just trying to tell our story and help people, just really kind of giving our testimony, and that in itself is probably helping a lot more people than what we know. So
Absolutely. Tracy?
Well, with me, I found out after the passing of Demi, the doctor was a dangerous doctor and he had a previous past. I wasn't aware of that, nor us. We walked in. So just trying to make young women be able and access to see who their doctors are. And if they have a past, it should be known for them to understand, and make their choices. And we just trying to get young girls to be aware of preeclampsia, because it is a serious, serious, serious disease. And like I said, a lot of the young women don't know it and they don't understand. And I'm members to a lot of the preeclampsia Facebook, and it seems like the same story over and over, that doctors aren't listening to these young women. And I have to shut it down because I get sick and nauseous, and I have to I want to tell these girls, your voice, we have to stand up and use your voice. If somebody would have told me more about this doctor, and if I would have known about preeclampsia, it might have been better for us, to bring it awareness. But as that's what we're doing, we're trying to get the word out about it. And like I said, I'll tell my story to everybody so that they don't have to go through this, because no family should have to go through this.
Right.
That's right.
Especially when it was preventable.
Exactly.
Dr. Crockett, I want to ask you, I know a lot of people probably that are listening may have experienced preeclampsia or know what it is, but talk about, and preeclampsia is just one of the conditions, maternal health conditions that can impact both the mom and the baby, as we just heard in this story with Demi Malachi. But talk to us a little bit about preeclampsia, what it is, how does it occur, and what are the warning signs?
Yeah, sure. Preeclampsia is one of the most common and the most serious pregnancy complications that can happen. It happens to 10 to 15% of pregnancies. So almost 1 out of every 5 pregnant women, or 6, is going to have it. And I think the point that we're hearing, that it's, sort of under-recognized, is very true. I spend a lot of time in my practice talking to patients about the risk factors. And in fact, the whole schedule of prenatal care visits, the reason why we want to see people every week at the end is because it's so often that you can see elevations in blood pressure. The definition would be blood pressure elevations over 140, over 90 would be a mild range blood pressure. And then a severe range is 160 over 110. So if you have blood pressures in the 160 over to 110 range, that's a patient that belongs in the hospital and shouldn't be managed at home at all, regardless of how late it is or early it is in the pregnancy. If it's a new blood pressure reading, it's different if patients have chronic hypertension, although their risk for preeclampsia is even higher. Patients do have a lot of symptoms from preeclampsia that they can recognize. The swelling that Tracy was describing in her daughter is very common. Headaches are another sign of serious preeclampsia. And then a lot of patients will have flashing lights in the edges of their vision, or if it's getting to the point where it's affecting their liver, they can have pain over their right side. And then, seizures it's eclampsia when you get to that point. So any of those risk factors, particularly in the end of pregnancy, shortness of breath, it can go with shortness of breath too. It can cause fluid buildup in the lungs. And it's, I do think Tracy's point about young women not being confident in their own voices is a good one. If you're feeling bad, it's important that you come in to get care and you're not bothering anybody. That's why labor and deliveries are open 24 hours a day, and we know emergencies happen, and you should come for care for sure with those kind of symptoms.
And then doctors and hospitals need to respond when there are those symptoms as well, right?
I've been training medical students and residents for a long time, and I do think there are many more good doctors that are very aware and responsive to this than there are negligent cases, fortunately. And I'm sorry that not everyone has positive experiences, but I do know that the March of Dimes especially has been engaged with a number of different quality initiatives nationwide, and focusing on hypertensive emergencies in pregnancy and responding to those has been a national focus, not only of the March of Dimes, but also of ACOG nationally. And a lot of state-led quality initiatives have been focusing on that. So as a specialty, we know we have room for improvement, but I think we also have a commitment to our patients to try to get the best outcomes we can. So
Yeah, absolutely. And I mean, this is, we're proud to be partners with ACOG to address these issues and make sure that we do everything we can on our end to make sure physicians and nurses and others respond to the needs of every single patient. Absolutely. Emergency physicians, right? Because when you show up at, labor in an emergency room, they may not be as familiar with some of the issues around pregnancy. So it's really important that anybody that interacts with a pregnant woman have this kind of training, because if a woman's in crisis, she's probably going to go to the ER. And that's a good point. Talk a little bit about when families do go through loss. Based on your experiences, and I'll start with you, Erin, and then Xavier and Tracy, if you want to chime in on this. What is your best advice to a family, especially if they've just now gone through loss? What is it that you wish somebody had told you at that time that may have been helpful, that you might share with others?
Sure. I think the fact that, and we try to emphasize this in our support groups, everyone is going to grieve at their own pace and in their own way. No two people grieve the same way, particularly within a couple. A lot of times men in particular are, especially with pregnancy loss, but even early infant loss, a lot of times men are kind of given the paperwork in the hospital and expected to kind of take care of things. And maybe not, their grief may not be acknowledged at the same level as the woman's. And so we try to make sure that everybody's voice is heard. And I think that when you're right after your loss, you're in such shock, there's such numbness. And so I think just making sure that everyone knows that, you're going to grieve differently. And I think that's a big, it's a big draw of peer support, is hearing from other people. You can hear from other couples or other families that are going through this and say, okay, so how I feel right now is normal. And you can relate to each other in a way that you're not going to be able to relate to people who haven't gone through it.
Yeah, I think she said it perfect, get involved in something, because especially with people that have gone through something similar, it's like, it opens up a whole different world and like a different kind of comfort level versus, talking to somebody that hasn't went through it, and they kind of look at you like you're a crazy person sometimes, just because they don't understand, they can't comprehend. But I think my biggest thing would just be, get your spiritual muscles going for sure, because that's what you're going to really need in the long run, and that's what really helps you internally and externally, but as well as get involved in a group and really talk about it. Have that communication. Hey, if you're feeling not so good or you don't want to talk today, let somebody know, like, hey, today's not the day. Let me just be in my room and sit here in the dark for a day or two, So just like Erin said, there's no right or wrong way. Everybody's different. So I think as long as you just kind of let whoever's going through that process, allow them to go through it. Don't try to, shortcut the process, because grieving is a process. There's levels to it. So I think the best thing you can do is really embrace it. That's what I think.
For me, it was a little bit different. Can you guys hear me?
Yes, we can hear you.
Okay. I literally couldn't get out of bed, and I crawled and I screamed and I yelled and I was mad, and I couldn't figure it out in my head, and my heart couldn't get there. I went everywhere for help. Everybody, pastors, priests, psychologists. I think I was looking for someone to tell me it didn't happen, or this is not something. I mean, literally, and sometimes I would tell my story and they would just they know what to respond to me. So I knew when they couldn't respond, I was in a bad place. I had to, you lose who you are. You're not the same mother. You're not the same friend. And that's hard for people to understand. You're not the same person anymore. And it's not fair to your other kids because you're not the same mom. And you don't know who you are anymore. You just kind of like try to find yourself and try to figure out. And people tell you get on medicine and don't get on medicine, and you have that, and they judge you, and you're like, you should be over it, or there's no time to get over your daughter and your grandson. I never got to touch Malachi or hold him or smell him because I was on the floor, literally on the floor. I lost everything. I just fell. My son picked me up, and I just, from that point on, I was just in shock for a year. I don't even know what I did or said, or if I brushed my teeth, if I combed my hair. So it, for me, I just have to look at the word trust God. Wow. That is really the one, when you sit there and say trust God, that's a very, this is like trusting God to the max.
Yeah.
When you lose a child and a grandson, it's like you can't figure it out. But for me, I'm getting there, and it's one day at a time. And like they said, it's like a thumbprint. Everyone grieves differently. And I'm turning my grief now into a fight and trying to make the difference in the world for Malachi. And, you know, Malachi's name means messenger. So she picked a really good name.
Quite a message. That's quite a message.
Yeah.
That's quite a message in his life, right?
But, you know, it's every day,
Yeah.
minute by minute. You sometimes have to stop and just say, okay, I'm going to breathe. I can get through today. And
Yeah.
then you try again. And every day you wake up and your chest is crushed and it's just there. And you just have to push through it. And I get my strength from her because she was a very strong young woman. She watched her dad pass away from cancer, and she was a daddy's girl. So I think of what she would do if she was me, and she would fight tooth and nail for Malachi. So I have to go,
That's right.
okay, I'm going to do this. I'm going to pick myself up at the floor and wipe my tears and march for other mothers in any way I can help, in any aspect of I can help any mother or any young girl. If they have a question, they could call me, text me, email me. Hey, I'm having these symptoms. What do you think? Or what do you know, just anything. That's what me and Xavier are trying to do for Bakersfield right now, and all over the world too.
Well, be careful, Tracy, because if we share your email or your phone number, people might take you
So,
take you
if
up
it
on that
saves
offer.
somebody, if it saves somebody, I'm just, you know, I'm
It's
just
all
waiting.
worth it.
That is worth it, yeah. And she's a beautiful girl. That picture of behind you is of her with Xavier.
That was
It's
5 days
beautiful.
before she passed. That was Sunday.
Yeah.
She passed Thursday.
Beautiful. Well, all these stories are so critical. I'm so glad that you all are sharing them. At the March Dimes, we did something last year, and it still continues, called Unspoken Stories, because a lot of people don't understand that this maternal infant health crisis is going on in this country. If we all understood these stories more and how often it happens, it may not be it's certainly not the vast percentage of all pregnancies, but every one of them is so huge. Every story is so big that, I think if you're not compelled to want to do something, it's hard to think that you have a heart when you hear something like the stories that are being shared. Would just like to ask, I mean, we have a question on Facebook, and just one of our questions too is, what other resources are available for families that may experience loss? And are there just other external resources that you've been able to access or would want to refer families to, either formal or informal websites or things like that, or other resources that you relied on or would want to make sure families are aware of? I'll just throw it open to anyone who wants to respond.
Well, I started Grief Share. I had a friend come and he's seen that I had posted I couldn't breathe, and he had lost his granddaughter. And he immediately called me and said, we're going to go to Grief Share because it helped me. And they took me, him and his wife. They drove. I couldn't drive. I couldn't make a cup of soup for a very long time. And they actually took me. So Grief Share did open the doors for me to understand.
And what is Grief Share, Tracy? Tell more about what that is.
It's a program. The church, a lot of the churches in most communities have it. It's just called Grief Share, and you go once a week and you watch a video. It's Norman Wright. He's a Grief Share specialist. It's his program, and so it's just helps to understand what you're feeling, and it's okay to feel these ways, but not to feel it like too long, because then you get stuck in grief. And but it did start with me. I've had the class twice, but most of the time I've got most of my help from my pastor friends and my priest friend, Father Craig. The encouragement of my faith has gotten me probably the most through it all.
Very good. Erin, did you want to jump in?
Yeah, there's a couple national resources that I think are pretty helpful for people that have been through a prenatal loss. One is Share Pregnancy and Infant Loss Support, and that just has a variety of national support groups. You can look up your state, your area, and find resources in your area. They have lots of helpful websites and articles on loss, just for the grieving families as well as for family and friends. And then another organization that is kind of more for immediately following your loss is Now I Lay Me Down to Sleep. And they have volunteer photographers all over the country that can be called to a hospital after a baby is stillborn. And they'll come and take pictures of your baby, of you with your baby, if you wish. And, a lot of times, and this was certainly my experience, a lot of times parents aren't sure if they want pictures of their baby right after their loss. It's something you don't think about. You don't expect to ever have to make that kind of decision. But it's one that I'm so thankful that we did. And I know every family I've ever talked to that has pictures of their baby is so thankful. That's all you have. Years down the road, that's what you have left. And so, I think it's an amazing organization, and they can be found throughout the country. So.
I want to follow up on that comment about having mementos from the delivery, which can be such a terrible day. And again, thank you to the March of Dimes. They make grief boxes for us to have on labor and delivery that have equipment in them for us to make handprints and footprints for families to remember. And they also have some clothes that we can dress the babies in, because especially if it's an early stillbirth, families haven't planned at all for this. And so if you're going to be taking pictures, then there's some sweet hats and dresses that the babies can wear, and some materials for making bracelets that have the babies' names. And so we're, and it packages together in a beautiful box. They've given us a Polaroid camera that we can use to take pictures with if the families don't have any other resources for that. And it really is a nice memento, and it may be all that they have to remember. And so, again, that's just like another example of the March of Dimes stepping in a place that's really difficult, but is extremely meaningful for our patients. And so I think having those, sometimes we'll hold on to the memories, and parents will come back and get them weeks later because they have changed their mind as they're moving through the grief process. And so we're grateful to the March of Dimes.
And we had another question, Dr. Crockett, while you're here. What information do you share with patients, especially when they are expecting or want to try again? I think you addressed a little bit of that, but if there's anything you want to add, especially if there's a family has gone through some grieving in the past, is there anything more that you'd like to share with folks about what you talk to parents about, not just on their medical situation or the health, but is there anything else that you particularly share with folks?
Yeah, I think, overall, there's a lot of hope in future pregnancies. It's extremely challenging. If you've been through a really difficult situation, there's a lot of reminders, even if the next pregnancy is perfectly normal, there's still a lot of stress and reminders of things that have come up and happened in the first pregnancy. And so, finding a doctor that you really like and can feel comfortable with and talk to, I think is important as you're doing that. But then looking at the specific cause of what happened to be able to anticipate warning signs if something similar is happening again, or just to be able to, provide reassurance that the same thing is not happening again. So I think it's really important to have a good, frank discussion with somebody who can kind of look at the whole picture of the situation and really give you a personalized, customized, plan and, understanding of what your risks are. And then, being able to put that plan into action. But it's, patients are always very anxious if they've lost one pregnancy. And so,
Right.
As a physician, it's important to be sensitive to the way that they're feeling as they're going through this pregnancy. It can be, even when everything is totally normal, it can be still very stressful and sad.
Absolutely.
Yeah, I think just to kind of, in addition to the medical, obviously the medical expertise and the doctor that you choose for the next pregnancy, I think just making sure you have a doctor with the bedside manner that you need. I know in my pregnancies after my loss, I had no medical reason to be anxious, to be worried, but I was. It's the nature of it. It's how everyone feels after a loss. And so having a doctor that I could call whenever I needed to, being able to go in for extra ultrasounds, it just made such a difference for my anxiety. And so I just think, making sure, that you find a doctor that can meet those needs.
And one of the things about another question we just got too is there, Dr. Crockett, are we seeing any increase in miscarriages, stillbirths, pregnancy complications as a result of coronavirus?
Right. I think we're still learning a lot about the coronavirus. The, cases were just first recognized in January. So the very first pregnancies that were exposed are delivering sort of like now. And so we don't have a lot of firsthand experience. Anecdotally, I know people have been reporting more stillbirths, but we don't know for sure. Some of the original data that came out of China seemed to say that they weren't really finding the virus in the placenta or the cord blood or on the baby, but there have been some conflicting reports about that. So, from my perspective, I'm just not sure we know yet. In my practice, we're doing growth scans on patients that have had the coronavirus just to make sure that there hasn't been any, type of impact to the baby that way. And we offer delivery at 39 weeks, which is a little bit early. But I think to be cautiously optimistic, it seems like women that recover from the coronavirus seem to go on and have normal and healthy pregnancies, but that, we still need to do more research. And the March of Dimes is supporting that too. So
we're trying to. And there's another question. Sorry, we're getting a lot of doctor questions right now. And this may be more like coronavirus related, I think, but the question just is, what can people do to protect babies and moms after birth? That may or may not be related to coronavirus, but that's the question. So,
we've been in terms of like specifically coronavirus, we've been trying to encourage families to really cocoon and just to keep maybe just the parents and the baby together, which is really hard when you have grandparents and other family members that are really excited to meet this new baby. But to try to at least through those first few weeks when the baby's immune system is still so vulnerable to really just try to be on your own and get through that as safely as possible. And then otherwise, it's just the regular measures that we're telling everybody, which is social distancing, wearing masks and hand washing. And so there's nothing, beyond just good basic public
what
health.
we know to do. That's right. Yeah. Yeah. Well, we are coming to the end of this, and I just want to say how much it's moved me, and I know everyone listening has been incredibly moved by, all of what you all have shared and how courageous you all have been, and you continue to be on a daily basis. Not only just trying to live your own lives, but how wonderful it is of what you're doing to help others. And that's, I want to say personally, thank you. And on behalf of the March of Dimes, thank you for all that you do. we do have, as we close out the webinar, we do have some resources. Some of them were mentioned. We have a whole list here of different resources that are available. As Dr. Crockett mentioned at the March Times, we do a lot to help and we do as much as we can, and we always want to do more to help families who are experiencing loss. And if you go to our website, we have a remembrance wall. We have resources around loss and grief. We have a site too where it's called Share Your Story, where a lot of individuals, a lot of families come and share their stories. You can read their stories, share your own. And we started some time ago a Facebook group that provides an online Facebook community for a lot of families to share their stories as well. We have the website for Erin's organization, Pockets of Light, pocketsoflight.org. And also, there was another individual that was going to join us today, and she wasn't able to. Actually, she had an emergency. Her name is Erica McAfee, and she does a podcast called Sisters in Loss. I've actually been on the podcast, and it's wonderful. I get little notifications whenever there's a new one, and she's doing tons of them. So it's on Apple, Spotify podcast. If you want to check that out, Erica McAfee, sistersinloss.com is her website, and Sisters in Loss is the podcast. That could be another resource as well. And then here are just a bunch of different websites that are available. And of course, this actual episode is going to be archived on our Facebook group. So if you want to share this session with any of your Facebook friends, share it on social media. If people didn't make the session today, they can always access it. If you know of families that need to hear some of this information and some of the stories that would help them, please share this with others. So to make sure that, we try to reach as many families as possible with the help that they need. The last thing I just wanted to remind everybody is that we are absolutely committed at the March of Dimes to advocating for preventable maternal and infant loss. We may not be able to prevent every single maternal loss, every single infant loss, but we know in this country, we have far too many moms and far too many babies that don't make it. And that's just simply unacceptable. And with our Blanket Change effort, blanketchange.org, and this movement, it's really around how do we make sure that communities have the resources they need, every mom and every baby, irrespective of race, ethnicity, where they live, that they have the resources they need to be healthy and to have a healthy pregnancy and to have a healthy baby, and for them as mothers to be healthy, and that families have the support they need, dads, grandparents, have the support they need to welcome that baby into the world and welcome that mom back home. That's what Blanket Change is about. And it's only going to be effective if you get involved. So please go to blanketchange.org and share it on social media. Make sure people hear it loud and clear that we demand change, comprehensive policy change to improve our maternal and infant health outcomes in this country. The last thing I'll just say is a little bit of a plug. We do this work at the March Times only because and only when we get the support from many of you. And we are heading into a time with Amazon Prime Day, October 13th and 14th. If you can remember to sign up for Amazon Smile and designate the March of Dimes as your favorite charity, then we can continue to do this very important work. And we would very much appreciate it. That's October 13th and 14th. So please sign up there. And then I think that's it for today. And let me just say again to Dr. Crockett, to Erin, to Xavier, and to Tracy, thank you all so much for sharing your stories, for being with us today. We're going to continue to be in this fight for healthy moms and strong babies with you. We're going to continue to hope to making sure that we've got a community available to support you all. And we look forward to celebrating your efforts to call for real change. And we're especially grateful for everybody's time today. And thank you all for joining us. And we look forward to the next session when we have our Healthy Mom, Strong Baby. So thank you all and have a great day.
Thank you.
Thank you.
Thank you.